Hi, this is Ken Bourne, Director of the Blastocystis Research Foundation. Not able to make it this year due to family commitment, but I wanted to send a greeting to all the researchers there and thank you for your hard work and continued dedication to this field. And your work has made all this possible. I think we can all be impressed with the fine work done by Drs. Yoshikawa, Tan, and Kumar, and all the others who set the stage for what we have now, which is a truly modern effort. It's got collaboration between East and West and North and South. We've got ways of understanding the organisms, such as DNA sequencing and PCR detection that have not existed previously. We also have, more recently, not just sequencing of the organism's DNA, but also sequencing of the host DNA to understand the exact nature of the host-pathogen interaction. We also have collaboration going on between groups in Mexico and Europe and China and as well as Singapore, Australia, and many other sites. I think we can all be impressed with the special acceleration in just the last 5 years. Thanks to Funda and researchers in Turkey and Karachi and other, we now have great acceptance in the world. We just saw the 1,000th study published a few years ago. ICOPA hosted the first Blastocystis forum just last year. And then this year we have certainly the first International Blastocystis Symposium in Ankara. And you can see the acceleration. As a numbers guy, I like to put a number on everything. We're set to break the record previously for number of studies published per year, which was a little bit over 60. And then I think we're going to exceed that in 2015. And that's due to the most increased participation, primarily just the larger number of groups that are studying that right now. Clinical milestones, it's said you don't know what you don't know, and I think we now have pretty good evidence that the treatment protocols that many people had thought would certainly eradicate the infection do not do that, and that's tremendously important for patients. Although it's not good news, it does help patients understand the limitations on therapy, and certainly when they don't respond to therapy, it can help them reduce the number of potential causes for that, and then also get a better understanding of the appropriate directions they should take with their doctor. We certainly also know that just exposure is not enough to cause illness. That's important, as some people might have the illness or have the organism but not have illness, and they would certainly need to have an understanding about whether it's appropriate for them to get treated or not. And then I'm always impressed when we get one group coming out with a particular study, and then another group in another part of the world working with another population and even using a slightly different methodology, being able to corroborate that. And I think that's what we had with IL-8 and IL-10. Certainly we had the good work done from Singapore that identified that as a factor in co-culture studies. And then that was work that was actually repeated earlier from Dr. Long in Germany. And then more recently we had host IL-8 and IL-10 production identified as factors relative to symptomatic expression in Blastocystis in Mexico, and then that was corroborated by actual measurement of IL-8 and IL-10 production in symptomatic and asymptomatic individuals. Trends in research, we try to look at areas where we can help out and to see where the research is going and where we might be able to add a little bit of guidance. One significant thing we have is the consensus, I think, among many that the rate of symptomatic expression it's not 0% and it's not 100%. It's somewhere in between, and that's tremendously helpful when we're trying to understand the significance of public health studies, population studies, and then also setting up research programs to try to get the appropriate populations into them. We also try to go where the numbers are, and right now we're seeing the more statistically significant results coming from studies that are looking at host factors, and that's going all the way back into the 2000s, I believe, with Mahmoud, and then more recently with Olivia Diaz and Yaqub, getting results where your p-values are 1 in 1,000. And then another interesting result is I think we did know previously that there was some evidence that Blastocystis cultured outside of hosts that were symptomatic behaved a little differently. and we have some evidence now that that actually may not be related to the organism, but to some of the host factors. And where we're going in the future, certainly we are focused on diagnosis and treatment of the disease. We get a lot of our support from patients, and clearly that is the ultimate driver for many of the studies in this organism. We don't want to treat patients that might have some other cause for illness, so a key factor is developing protocols that are able to split off the symptomatic and asymptomatic cases, and that's especially important for selected populations for study. Because if you're doing a study and you want to study blastocystosis, and if your population has a large number of people who have that as a infection but not necessarily cause of illness, then that's going to throw off all the results of your study, and your study won't be repeatable because a different individual from another group might be able to put another population together and not get the same mix that you originally got. Certainly, if we can understand why some people have symptoms and others don't, if we don't have an eradicative therapy, the next best thing is to knock down the symptoms, and that's certainly of interest. The focus so far has been on conventional eradicative therapies, and that remains a subject of continual interest, although a number of people have tried and as yet not succeeded with reaching a goal that might be comparable to what's seen in other protozoal therapies. And then finally, we do know some patients are exposed to blastocystis and clear the infection, and others don't, and it would be great to understand why. Again, that may not be a blastocystis thing, it may be a host factor, and there's been some good research done in any histolytica, at least in animal studies, that can show that some of these things relative to cytokines may influence whether a particular infection develops into a chronic long-term infection or is able to be cleared by the host. And the last message I wanted to give to all of you would be to enjoy the symposium. Thank you very much for your time, and hope to be in touch over the coming months.